Can you talk a bit more about some of the complications of TPN and PPN?
Yes, sure. So the most frequent is an infection of the long-term catheter, an infection of the Hickman, the PICC line. 1/4 of the patients on long-term TPN will have an infection from the catheter, and it's mostly Staph aureus that happens. And then depending on the situation, depending on some criteria, we decide if we have to remove the IV access or can we try to rescue it with IV antibiotics and also log therapies where we ingest a very high concentration of antibiotic into the line. The other problems that we see sometimes are occlusion. So either because the catheter kinked, either because some medication precipitate in it, thrombosis also happens. Then in the long term, our patients are progressively losing their IV access, like each of the veins develop eventually some thrombosis. And this is an indication for intestinal transplant if you are losing all of the access for parenteral nutrition. We have some people that are developing like hyperglycemia. So when you have an inpatient, a patient in the ICU, be mindful with the blood glucose, start insulin, depending. And in fact, too much calories for ICU patients that are ventilated, it can cause like hypercapnia, and then their ventilation requirement change because they're suddenly burning more calories and producing more O2. But on the other end, those ICU patients, if you stop suddenly the TPN, they may become like hypoglycemic. The lipids, you can have hypertriglyceridemia. We check every week or so the triglycerides and we adjust the glucose and the lipids depending on the amount. And also, if you have an ICU patient that is on propofol on top of the TPN, these are two sources of lipid that can contribute to this triglyceridemia. And I touch about the liver issue. So there are different things that happen. So it's not natural to not use your GI tract. Like when you eat, there's a release of cholecystokinin, which makes the gallbladder like contract and shoot out into your GI tract. If all of your meals are from the parenteral nutrition and you're not using your GI tract, there would be some sludge developing in your gallbladder. People are at risk of developing like gallstones, acalculous cholecystitis, regular cholecystitis if they are not eating at all. I mentioned steatosis that happens quite rapidly. And then in the long term, it can becomes into a cirrhosis. And then we see lots of like cholestasis that can be caused by the lipids, having too much calories. And when it happens, we have to be mindful about the copper, the manganese. We need to ask the nurse or the pharmacist to readjust the TPN component so there's no accumulation of all of that. Yeah, I think these are the main complications that we see.
Before, when you were talking, you were saying how a lot of them end up with fatty liver disease. Is that just a complication or that likely going to happen? And what's the time frame?
Yeah, so the steatosis happens as soon as like a month after starting the TPN. The majority have fatty liver at 3 months after starting TPN. It's because it's putting lots of sugars and fat directly into the liver, and that kind of triggers additional lipogenesis. And there is also more insulin that gets secreted than when you only have the oral intake. It's something that we can try to balance with the calorie intakes that people are having, the type of fat that people are having, but it's still developed in most individuals.
Can you give a soundbite of what is lock therapy for people who haven't heard of that?
So it's a syringe that has a very high concentration of like vancomycin or piperazine tazobactam in 2 ml. And then we plug that into the initial line of the TPN, but we clamp the IV near the skin. So at first, the antibiotic is only in the part of the line that is outside. And then we unlock it and then have it go down into the rest of the line because lots of the infections are caused by bacteria that kind of like biofilm that attach inside of the line. And sometimes to let everything marinate helps just kill those bacteria.